Everyone. My name is Dr. Charlotte Frinton, and I'm a teaching fellow, researcher, and behavioral scientist in the field of public health. Our health depends to a great extent on our behavior, or in other words, on what we do. This is true for public health, but also for clinical practice, as you will have seen in the previous videos in this series. In this episode, I will talk to you about extrinsic motivation and medicine adherence. The objective of this video is to give you an overview of what extrinsic motivation is and how it can influence medicine adherence. Motivation refers to our drive to do something. And one thing we should immediately note is that our motivation is specific to a particular behavior, or in other words, our motivation can be different for different behaviors. For example, I might feel very motivated to go and enjoy the sunshine outside on a sunny day, but not feel very motivated to put on sun cream. Even though both of these behaviors relate to the sunny weather, in case of going outside, I feel very motivated, while in the case of protecting myself against the possible harms of sun exposure, I do not feel very motivated. We can have a lot of reasons for why we are motivated or not motivated to do something, and it can be useful to divide them up into three categories as depicted in this graph. On the left, we have amotivation. This means that you are not motivated to do a particular behavior at all, such as when I did not feel motivated to put on sun cream. When we move to the right in the graph, we move to situations where we do feel motivated, but our reasons for this motivation are qualitatively different. Extrinsic motivation means that we only do the behavior because of some external reward or pressure, while intrinsic motivation refers to motivation that comes from a personal experience of valuing the behavior, such as experiencing satisfaction from it, having a personal interest or passion for it, or finding the behavior rewarding in itself. So when we are intrinsically motivated, we want to do the behavior because we want to do the behavior itself. While for extrinsic motivation, we need something else to convince us to do the behavior. This something else could refer to factors such as money, grades, praise, recognition, or avoidance of punishment. For instance, a student may diligently study to achieve high grades, which serves as an external validation of their efforts, rather than out of a genuine interest in the subject. While extrinsic motivation can effectively prompt specific actions and achieve short-term goals, it may not foster long-term engagement or deep intrinsic passion for the task at hand. As you can see from the graph, we tend to think of this type of motivation as sitting on a lower level of autonomy compared to being intrinsically motivated to do something. Some examples of extrinsic motivation can include rewards, such as when a person completes a task to acquire money, praise, or approval from others. It could be because of punishments, such as timeouts, the loss of certain privileges, or suspension from school or work. It could be out of competition with others. For example, a person might want to perform better than their peers when it comes to school grades or behavior charts. And it could be for compensation, such as tips, company perks, and pay rises that can motivate people to work hard when providing goods or services. Extrinsic motivation can also be used to promote medicine adherence among patients, utilizing external rewards and consequences to encourage compliance with prescribed treatments. For example, praise, but also disapproval from the shop floor staff when a patient comes to collect their medication or returns unused medication can be a powerful reward or punishment for the patient. Healthcare providers might also use adherence tracking tools, where patients receive reminders and recognition for meeting adherence goals. Programs that offer discounted medications for consistent adherence, as well as the threat of negative consequences like increased medical costs or health complications, also serve as powerful extrinsic motivators. As I mentioned before, while strategies that rely on extrinsic motivation can effectively enhance adherence rates in the short term, they might not foster a deep intrinsic understanding of the importance of medication compliance, potentially leading to lapses in adherence once the external motivators are removed. This reliance on external incentives may result in patients viewing medication adherence as a task to be completed for a reward, rather than recognizing its critical role in managing their health. So when the incentives are no longer present, patients may lack the internal drive to maintain their medication regimen, leading to inconsistent adherence and potentially adverse health outcomes. Therefore, it's crucial to complement extrinsic motivators with educational efforts and support systems that cultivate intrinsic motivation, helping patients internalize the value of their treatment and maintain adherence independently of any external rewards. Now, for those of you who've watched the video on the COM-B model, you may have noticed that this model also includes a construct called motivation. In the COM-B model, motivation can be divided up into reflective motivation, which means all of those reasons for doing a behavior that we have consciously thought about, and automatic motivation, which are more unconscious reasons for doing something such as habits, emotions, desires, and impulses. Unfortunately, the way in which motivation is characterized in the COM-B model does not neatly map onto the constructs of intrinsic and extrinsic motivation that we are talking about today. They are two separate ways in which we can think about motivation. When after this video, you come to think about how you'd like to facilitate medicine adherence among your patients or clients, it may be worthwhile thinking about whether you are using ways to intrinsically or extrinsically motivate them, and whether your strategies favor automatic or reflective motivation. To sum up, some key takeaways from this video are that extrinsic motivation is driven by external rewards or consequences, such as tangible rewards or avoidance of punishments. While effective for short-term tasks, over-reliance on extrinsic rewards can create future issues with motivation. Medicine adherence can be influenced by extrinsic motivation and can be a starting point to tackle issues with compliance, but long-term adherence might not be possible with extrinsic motivation alone. That's all from me. I'll leave you with some references in case you want to do some further reading on the topic. Thank you very much for watching.